This video is part 2 in our series of soft tissue-based injuries of the hip, and in this video we're going to be covering advanced palpation in functional-based treatments. Well, what's up everybody, Dr. Matt Maggio here. And those of you that don't know me, I am the creator of the Peak Method and the founder of the Soft Tissue Revolution, where we teach self-employed massage therapists a new treatment system that focuses on working smarter, not harder, allowing them to cut their treatment times by 50% so they can stay healthy and help more people get out of pain. So this video is part 2 in our 3-part series of soft tissue-based injuries in the hip. In the first part of the series, I covered what the clinical presentations look like and functional tests. If you're watching this on YouTube, I'll link it up right up top here. If you're watching on Facebook or LinkedIn, I will put it down in the comment sections below. In this video, what I really wanted to dial in on was the role, the function, the palpation, and the treatment of a very important muscle in hip flexion, which is actually the adductor magnus. So what I want to include first in this week's breakdown is a very detailed palpation of the adductor magnus, finding landmarks and making sure you are right on it, because a lot of times people end up being too far forward on the gracilis or too far back on the hamstring, and if you can't find it, you can't fix it. So I'm going to link that video up right now. So we're going to look at what's called the adductor magnus. So this muscle gets completely disregarded by everyone out there, but it is so important. It takes up such a huge portion of the cross-section of the hip, and it is so important in hip flexion, hip stability, and everything like that. And a lot of times people are way too compressive when they palpate or they go and work on it. So essentially what I do is I landmark in through here. So you have up here, you'll have the gracilis and a little bit of the quad muscle, and then you can see that I can really sink in through here and back here through the hamstring. So essentially the adductor magnus lives in between there. So I will work my way through and get down there, and it doesn't need a lot of palpation in there because it's pretty superficial, but you can see how my thumbs can really sink in there and really open that up. Now, a lot of times people are too far out here, and that'll be tender to the patient, or they're back here on the hamstring. It has to go right in between. And usually where you're going to find the most amount of scar tissue or adhesion is right in through this region as well. So this one only works with hands-on. If you're using an instrument in here, you just don't like your patient. Now, essentially what you want to do is find where that limited spot is from your palpation, and then you want to get your depth and your tension on it and break that down and then retest that. A couple take homes from the video. First is, you can see, just slow down. Don't be in a hurry. You know, so many soft tissue practitioners just want to jump right into treatment, and they get confused, they get haphazard, they're not getting to the right area, they're not slowing down. Find your landmarks, slow down, do the work to actually find where it is, because it's going to make for a more effective treatment in the long run. Whenever it comes to an injury, there's always an order of operations that we must follow in order to fix it. The first step is we must restore range of motion. Injuries happen because range of motion is limited, and a lot of times that is because there's an accumulation of scar tissue in the muscle. Scar tissue is like glue, gets inside the muscle, makes it very weak, very inflexible, and also limits that range of motion, like I said. So what I want to include next is a very detailed treatment using my treatment called manual scar tissue treatment to the adductor magnus muscle from one of our CUU courses online. We're going to be treating the adductor magnus. Make sure you watch the advanced palpation before, because a lot of times people aren't actually on it. They're either on the gracilis or the hamstring, and when you don't get this right, it can make it very excruciating for your client. Now, the key here is all in the body and the mechanics and everything set up for that. So what I like to do is have it resting right on my hip, because what we're going to be getting is this hip flexion, and you're going to use that to kind of lean away. So after you palpate and you find the area, you want to get in there and get some lotion on it to start, because this area can be very sensitive, but it's very important for overall hip function. Once you identify the area where the scar tissue is, now you're going to get in there and start to do the treatment as well. So you found it, let's say you found the scar tissue right here. We want to go just inferior to it, because this is going to be internal slide, it's going to come to us. So what I do is I see how this is right up against my body in here, and I'm going to get into a stance where I'm facing away. And the first thing you're going to do is you're going to back these thumbs up. So come in a little bit closer for me. So what you're going to do is back these thumbs up. This is going to allow me to get my depth and my tension. So the first step is I'm going to get my depth by leaning in with my body, just like that. I'm gonna come out just a little bit, and then my tension is going to be rolling my thumbs just like that. That area is loaded up, and then what I'm gonna do is take this other foot and step that back, and I'm gonna go nice and slow and let that come to me. I am not going to slide, I'm just gonna be very precise and let that come through. And you wanna go nice and slow with this treatment as you do that. Get this leg in your hip. It's gonna help you take some of that pressure off your hands. And the key here is you're going to reach with this opposite foot in almost like what's called a fencer stance. So when you finish, you're gonna end up like this. So I'm gonna show you the way the motion looks. So I'm not gonna do the actual treatment part here. I want you to see the body mechanics. So we sink, we're in, I step this way, and then I lean away like that. And I can really, when it's a really bad area of scar tissue in the adductor, I can lean my body in there and get some of that increased tension in there. So the key is getting that motion first, but taking the time when you start to find the area where that where that scar tissue is. And if you're still learning, getting it figured out, draw a little marker in there too. It might help you kind of line it up, because if you did all the work to find it, but then you're thinking about the mechanics, it's gonna mess with you just a little bit. But this area is very important, and the key here is using your body and using your weight to allow you to get the rest of that motion in there. One thing you'll see with my trainings, my treatments, my methods, my system, it's very deliberate. It's very focused. It's not all about just doing a bunch of treatment. It's about doing the right type of treatment. So much manual therapy is like a shotgun approach. Try a bunch of stuff, throw everything at it and see what works. I'm more of a sniper approach. We want to line it up, find it, go get the kill shot with just the right amount of depth and just a right amount of tension. That's what actually breaks down that scar tissue. And this area in the adductor magnus is very sensitive, especially if people have a chronic hip injury. So you want to get the right amount of depth and then the right amount of tension and have them go through that range of motion. That tension and proper depth is what actually breaks down that scar tissue and restores that range of motion, because that's the first step we have to do when fixing an injury. A couple take homes from the video. Once again, be slow, be deliberate, be precise, and be focused. You know, don't always be in such a hurry. I always say you got to go slow in order to go fast. And a lot of times if you just collect the right data, like we shared in the first part of this video series, then do the right palpation, then the correct treatment, you're going to get really good long-lasting results, and that treatment is going to be safe, effective, and durable, and it's going to help your patients and clients stay out of pain for much longer than most of the other treatment methods out there. If you like the video, let me know what you think in the comment section. Go grab our free training. We dive into a lot more functional-based testing, critical thinking, palpation, advanced treatments just like this using my system, the PEAK method. And lastly, if you like what you see, you've gone through some of the free training and you want to learn more and get on that journey to become a true solutions provider instead of a service provider, reach out to us and take one of our CEU courses. They are available online and in person, and it's the next step to getting so damn good that people can't ignore you. Appreciate you guys watching this. On the next video, we're going to dive in really deep to what's called the posterior hip capsule, which is a main component in anterior hip pain, hip bursitis, and even hip impingement. So be on the lookout for that. Appreciate you guys watching. We'll see you on the next one. Bye.